I remember being on call one night and I had a patient who was deteriorating. And I found myself trying to convince the intensivist that taking the patient to intensive care was not futile. And the discussion was about, how brutal is your treatment? Why are you even doing this to the children?
The chemotherapy for AML is the most intensive chemotherapy that we give.
Pediatric AML is a very aggressive form of cancer. Many that don't survive, not from the leukemia itself, but from complications that arise because of the toxicity of the treatments that they're given.
Chemo was pretty brutal, especially the first time. I had a 10-day treatment 2 days after I was diagnosed. It was sleep, wake up, throw up, sleep, just pretty brutal, and that drove home the concept of cancer for me. It was pretty bad.
We've gotten as far as we can go in terms of intensifying the chemotherapy that we're going to do.
In a nutshell, what we're trying to do is develop something that's minimally invasive and allows us to discover recurrent disease early so that we can alter treatment and make good decisions that result in less treatment and less harsh treatment for kids down the road.
I remember when my sister Taylor was in treatment, a lot of her bad days or her sick days would be from the medicine. Unfortunately, 1 out of every 2 patients diagnosed with AML will have a relapse, and this is why this research is so important, because in the last years we have made hardly any progress in early detection of AML.
With leukemia cells, the nature of leukemia is that it first builds in the bone marrow. We don't know what bone. Any bone can be home to new leukemia cells or recurrent leukemia. And of course it seeds through the bloodstream. What we're developing is an assay that looks at small particles that are released from cells, all cells in the body. Particles, they are called exosomes.
Exosomes are tiny vesicles, and they are present wherever there's fluid in the body. They basically are cell communicators, and they carry certain markers that could indicate leukemia.
They're about 100-fold smaller than a cell. It allows these exosomes to flood into the bloodstream. At any point in time, these exosomes will show up in the peripheral blood.
It would be for a much earlier and less invasive detection, and hopefully more accurate than the other spinal taps or bone marrow pokes.
It's a test that skirts the entire issue of which bone is it coming back in. There's enough of a track record to make this a credible approach that has already shown in, for example, melanoma, skin cancer, that having more aggressive and more widely spread disease will lead to a change in these exosomes and what they contain that we can measure.
Our ultimate goal is for a cure in childhood leukemia, but a improvement in any sort of early diagnosis or less painful treatment would be a great step and would be a great improvement in the quality of life and treatment during leukemia, and would hopefully lead farther down the path to a cure.
Pediatric AML does not get very much attention in terms of funding or research. It affects such a small patient group compared to many other pediatric cancers that it really gets left behind.
You know, there's a lot of financial incentive, for example, to develop new drugs for cancers that happen commonly, and those cancers tend to happen in adults.
Having gone through this diagnosis and treatment with my child, knowing that there was a cure would impact me on a daily basis. We live with a constant worry that he will relapse. And we have met children and their families who have had a relapse, and knowing that there was a cure I don't think that I could put words to how wonderful that would feel, just for our family, and just to know no one else would ever have to go through what we went through.
The groundbreaking research being done by Dornbecker Hospital offers hope for early detection, less intensive treatment, and a higher survival rate for children with AML. You can make a difference by donating today.
To you and many more. Yay! Okay, Maxer. Go get it, buddy. Go get him.
Glasses. Bomb.